whatever reasons the stigma exists, and there are other cultural factors like you've mentioned. One could be familial. What would my family think of me, or how would they respond to me? How would my spouse respond to this? Whatever. Kids might think my parent won't understand this or whatever. Second, I think professional stigma, wherein if I acknowledge these symptoms, would it be looked at as my weakness in my professional circles? Would I be, no longer be seen as a leader? That kind of a stigma. Now, there is Dr. Naveen who's mentioning about, there's another interesting angle since we have some doctors attending today. Healthcare workers who are going out to work during these times, who are at the risk of getting exposed to the disease, frontline health workers, be it nurses, doctors, whoever, the kind of stress and anxiety that they are in, because there's another complete different angle there that, what if I get infected, sort of a thing. Now, keeping all of these in mind, we are all going through this for whatever reasons. If we ignore these symptoms and don't act upon them, could you talk, what are the dangers then?
I think the principal danger is of unnecessary suffering. One of the commonest things about mental health problems and depression in particular is that depression is very common, and depression is easily treatable, and almost everyone who suffers from depression and receives some sort of help, counseling or treatment are going to recover. In my 22 years of experience, I've never seen a person not recover from depression. So you need to take away from that if you have a problem, it's going to be solved. It might just seem, for example, for a clinician, we see depression all the time, but for a patient, it might be the first time that they're experiencing this. So, you can take my word for it, that if you have got an emotional problem which is significant, it is going to get better. People have to very clearly understand that what depression is not. It's nothing to be ashamed of. It's not a character flaw. It's never a sign of weakness. And you can't just snap out of depression. You can't just ask somebody to get on with it. And that's the common fallacy that people have, to say that it's going to be okay. Let me just endure it for some more time. And if you ignore the signs of depression, even after having recognized it, then the suffering is going to be prolonged. And there is a lot of clinical evidence to say that if the treatment is delayed, and the treatment could be just talking intervention or counseling or getting a guidance into the right direction of resolving your problem, or medication in some cases, then your recovery is faster. And that's what needs to be understood. So the sooner we intervene in whichever way you need to, the sooner you're going to get better. And the suffering and the intensity of the problem will also be reduced. When we do counseling, what do we do? Or when we do therapy, we turn a person from problem orientation to solution orientation. This simply means that you come with a problem and you're just embroiled in the problem itself. And then you start to look at to say that, this is a problem and it's not that bad. And we need to look at 1, 2, 3, 4 things to do. So you shift them from problem to solution orientation, and that becomes a path of recovery. So don't ignore it. Get whatever help, because it's almost certainly going to get better faster if you get some support.